My project is looking at the best way to position patients for their treatment. We can treat patients either lying on their back with their arms up, or we can treat them lying on a special board on their tummy, and it changes the position of all of the anatomy around what we want to treat. So we try to avoid giving radiation to things that we don't want to receive it. Early breast cancer is the most common presentation at diagnosis, particularly for women in Australia. Most commonly, they'll be treated with a wide local excision, which is surgery where they remove the tumour and a little bit around it, and then they'll follow on to have radiotherapy after that. We are fortunate to have one of 4 machines in the country that are an MR Linac. So in a traditional machine, we do a CT scan and check out the positions. Particularly in the breast context, some of the challenges are just the physical size of the MR bore. There's only a finite amount of space in there, so getting someone in a position that's best for them and to be able to deliver that treatment when they've sort of got to lie there for about half an hour can be a little bit tricky. But on the MR machine, we can actually have a look at this, work out what's best for them, and then set them up for treatment in that position without having to give them radiation. It means shorter time for treatment scans and all of the workup in the meantime before they get to treatment. And then longer term, we're kind of hoping to use this information on some more novel projects that have come up in the future. So looking at delivering bigger doses over even less treatment numbers. In a course of 5 treatments, that's 1 week versus 3 to 5 weeks being away from home. There's long-term data that says that it's no different in effectiveness, so we can safely deliver it. The side effects are comparable, the treatment outcomes are comparable. There's no compromise by changing from this longer treatment to a shorter treatment. So the opportunity to again improve that aspect of treatment is really exciting. Being supported by the fellowship gives me dedicated time to actually work on my research. So one of the biggest challenges I think for most people trying to get into research and having a clinical role means that you trade off one or the other. So having these opportunities is invaluable at any stage, but particularly someone earlier on in their career. It's really, really exciting to get those opportunities to learn something new and hopefully make a positive impact for our patients.